Hello and welcome to Oral Medicine Simplified. I'm Dr. Suman Said Siddiqui, and today we're starting our very first video on an important topic called Introduction to Oral Medicine. This series is designed to make oral medicine easy and practical for students and clinicians alike. Oral medicine is a specialized branch of dentistry which focuses on the diagnosis and medical management of diseases that affect the mouth and jaws and the surrounding structures. It also deals with the oral manifestations of systemic diseases. In simple words, it connects dentistry and medicine. Why is oral medicine important, you may ask? Well, many systemic diseases present first in the mouth. So oral medicine helps diagnose those diseases. It helps in the early detection of serious conditions such as oral cancers, diabetes, anemia, heart diseases, or bleeding disorders. It bridges the gap between dentistry and medicine and guides in safe dental care for medically compromised patients. In oral medicine, we cover uh, conditions like ulcers, white and red patches, orofacial pain, such as temporomandibular disorders and salivary gland diseases, and even early cancer detection. We are also involved in managing oral problems in medically compromised patients. An oral medicine specialist is primarily a diagnostician. They identify complex oral conditions, manage them medically, and work closely with other healthcare professionals to ensure comprehensive patient care. They also play a key role in oral cancer screening and prevention. So we diagnose complex oral conditions, provide non-surgical management, work with medical teams for comprehensive care, and we are an important aspect in oral cancer screening and prevention. Now, what is the difference between oral medicine and oral surgery? It's a very common confusion, and I'm here to discuss what the exact difference between oral medicine and oral surgery is. So, oral medicine mainly focuses on diagnosis and medical management of oral conditions, like non-surgical management of oral conditions. Whereas oral surgery deals with the surgical treatment of the oral and maxillofacial conditions. The scope of oral medicine is related to the oral mucosal diseases, orofacial pain, systemic manifestation of diseases or systemic disease manifestations, whereas in oral surgery it is more towards extractions, jaw surgeries, fracture management, etc. The treatment that we provide in oral medicine are mainly medications, habit counseling, and supportive care, whereas surgical procedures such as cyst removal, tumor excision, these are all done in oral surgery. So we do the non-invasive stuff, which is clinical examination, biopsies, imaging, and imaging interpretations, whereas oral surgeons are involved with invasive stuff like incisions, extractions, and surgical reconstruction. The goal of oral medicine is to control and manage disease and improve the overall quality of life of the patient. Whereas in oral surgery, it is the removal of pathology and restoring the structure and function. Oral medicine is mostly outpatient clinic department, whereas oral surgery can be both outpatient and operating rooms. The duration for which oral patient comes to oral medicine clinic is pretty long. We patient come to us for long-term follow-ups because we are dealing with medications and chronic diseases, whereas in oral surgery there are short-term interventions with post-op follow-up. Now I'm here to discuss some commonly managed conditions in oral medicine. Of course, we're not going to go in deep discussion of all these things, but a slight knowledge in the first lecture is somewhat important, I guess. So the first disease that we most commonly deal with is recurrent aphthous ulcer. Recurrent aphthous ulcers can look like this. These may show as the erythematous borders and white center. Okay, so recurrent aphthous ulcers are commonly known as canker sores and are painful, non-contagious sores that repeatedly appear on the soft tissues inside the mouth. So it can happen over and over again, hence the name recurrent aphthous ulcers. They are the most common type of oral ulcerations and they affect up to 20% of the population. The second commonly managed condition by oral medicine is oral lichen planus. So oral lichen planus can appear like this. So this is the cheek or buccal mucosa, and as you can see there are some white striations over here. These striations are called Wickham stria and they are the hallmark of oral lichen planus. Okay, so what exactly is oral lichen planus? It is an autoimmune condition. It is non-contagious. It can be painful or not. It cannot be painful. So oral lichen planus is a chronic, non-contagious inflammatory condition that affects the mucous membrane inside the mouth. So while the exact cause is unknown, it is considered an autoimmune disorder in which the immune system mistakenly attacks the cell of the oral lining. The condition can cause a variety of symptoms from painless, lacy white patches to open sores that cause burning sensation. We may also deal with problems like burning mouth syndrome. Now we do not have any picture for burning mouth syndrome. Why? Because it is a condition that is felt by the patient, but there are nothing visible, no visible clinical signs present. The patient may feel symptoms, but the doctor cannot see any signs, and we will only diagnose the patient with burning mouth syndrome when we see no other sign, when we have excluded everything else. So burning mouth syndrome is a chronic and often painful condition which is characterized by a scalding or tingling sensation in the mouth without any visible source or clinical signs. It typically affects the tongue, lips, roof of the mouth or gums and may be accompanied by a dry or altered taste. Then we also deal with oral submucous fibrosis, which is common in the South Asian population like India and Pakistan due to the use of areca nut. So as you can see, we have pale mucosa, limited mouth opening, some ulcerations over here and here. So what is oral submucous fibrosis? Oral submucous fibrosis is a chronic, progressive and precancerous condition of the oral cavity that leads to the hardening of the tissues under the oral lining. The disease is primarily associated with chewing areca nuts, which is a common practice in South Asia and often results in limited mouth opening. Oral medicine also deals with the early detection of oral cancer. How, you may ask? Well, oral medicine specialists are generally present in the diagnostic departments of any institute. So every patient that comes in the hospital or clinical setup has to go through a screening done by oral medicine specialist. And an oral medicine specialist does what? They check the labial mucosa, they check the roof of the mouth, the tongue, the lateral border of the tongue, dorsal of the tongue, ventral surface of the tongue, uvula, floor of the mouth. We check everything for any red lesion, any white lesion, any ulcer, anything present for more than 2 weeks needs to go through investigations. So oral cancer is a type of head and neck cancer that can develop in the lips, tongue, cheeks, gums or the roof and floor of the mouth. Most oral cancers begin in the flat, thin squamous cells that line the mouth and throat, and early detection is critical for a better prognosis. Why? Because our face has a lot of lymphatic channels there, that are draining the face. So spread is very quick from this area. Then we also deal with salivary gland disorders that can be related to any of the three major or minor glands. The major glands are in pairs, which are parotid, submandibular glands, and sublingual gland. And we also have some minor salivary gland, and which can be present on the roof of the mouth and on the but uh, minor salivary glands do not mean that they cannot be associated with diseases. Oral medicine deals with the diseases and conditions that are associated with major as well as minor salivary glands. So salivary gland disorders are conditions that affect the glands responsible for producing saliva, leading to symptoms such as reduced saliva flow, swelling, and pain. The salivary glands are located in and around the mouth and throat, and these include three major pairs: the parotid, submandibular, and sublingual glands. So on this channel, we will simplify oral medicine for you. Expect easy to understand explanations from us, case discussions, exam-oriented MCQs, and practical clinical tips. Thank you for watching my video. If you found this helpful, don't forget to like, share, and subscribe to Oral Medicine Simplified. In the next video, we'll discuss common oral mucosal lesions in detail.